Thank you for tuning in to the MOA podcast, where a group of SRNAs break down the mechanics of anesthesia science, education, and beyond. Welcome to the second episode of the MOA podcast. Today we have a very special first guest joining us. This gentleman has been a CRNA for over 35 years, a nurse anesthesia faculty member for over 15 years, and he has been the Associate Program Director at Rosalind Franklin University's Nurse Anesthesia Program for the past 8 years. It is a pleasure to welcome to the podcast Dr. Peter Kallio.
Thank you. I'm glad to be here. You make me sound kind of old there, but
It's
experience does matter.
Yes, it's experience. So just to kind of recap, last week we talked about our nursing backgrounds and then sort of our individual processes of applying to school and ultimately why we wanted to become CRNAs. So to start this podcast, Dr. Kallio, why don't you begin kind of telling us about why you became a CRNA and sort of how you got to where you are now.
Okay. Yeah, it's a good story. We all have sort of our own way of discovering nurse anesthesia. My case was a little bit unique. I grew up in the military. My father was career military. We were stationed overseas a lot. When I went off to college, my first year I became a paramedic, got paramedic certified, and then in the summers between college years, I would go back. My dad was stationed in Germany at the time, and I would go back and work at the Army hospital in Germany and work as a paramedic. And it was there in the ER where I first saw CRNAs in action, coming down to start lines and intubate in the ER. And realized that these guys weren't physicians; these guys were nurses, and it was like, So I talked to them and said, well, what do you guys do? And they explained it, and then they said, hey, come on up to the OR anytime you want. And that was it, man. I was sold, and I knew from that point forward. So I switched gears in my college majors and went and actually transferred schools and went into nursing. I knew that was my road.
That's awesome. I think that attests to the fact that we kind of each have our own like individual path to get there. And it's definitely that needs to be unique. You know, it kind of makes your road to CRNA individualized. So thank you as well for serving in our nation's military. I think that on behalf of all three of us, we are very thankful for anyone that serves. So and you did.
Yeah, well, that was after school that I went into the military. But it was my dad's military service that got me, interested in where it was.
Absolutely. You've kind of been like a military guy for a good portion of your life, from what it sounds like. So,
pretty
in
much.
one way or the other, yeah.
You've been teaching for about 15 years now, or over 15 years now. So, what made you interested in teaching?
Well, it was funny because my career started off. I stayed. I should backtrack and kind of go backwards to how that all started. When I did graduate from nursing school at Marquette University in Milwaukee, and then knew that I had to get into the ICUs, and I got into the ICUs right away. And within 2 years, I applied and got into the Milwaukee County School of Nurse Anesthesia. At that point, they were taking 3 students a year. The main base training was at the Mother Hospital there that I ended up staying right after graduating and became employed there at Frederick Hospital, and spent a year or two there before I went into private practice with a group that formed with residents out of training and a couple of CRNAs from Frederick. We went and took over a private practice in Racine, Wisconsin, a small community hospital. Well, it was a larger community hospital, actually. And we started our own group down there. And so I worked in a community hospital setting, and it was right around that same time, right after graduation, that the military came knocking at the door and offering a lot of tuition reimbursement and sign-on bonus and all that. And certainly we were cash poor at the time, and lot of loans, and it all panned out really, really well. I stayed in private practice for about 10, 15 years, and then moved to the VA in Milwaukee as a position came up, and it was a new position that helped us, helped get me closer to home. Actually, I was commuting a bit, got me closer to home, but also was able to take care of veterans, which was a big deal for me. And it was there at the VA that my career sort of culminated and moved me into teaching, because we were approached to become a clinical site for Rosalind Franklin University. It was a program that was just starting out. This is back in like 2008. We were approached to become a clinical site, and we were actually one of their very first clinical sites. So that's how I got it involved into teaching. I was the chief at that time, at the VA, and was happy to be part of that solution. And I was a clinical coordinator for a long time, before I was asked to, hey, can you start lecturing for us? And so I did start lecturing, and that turned into a full time gig. And here I am as associate program director, and really excited about what I do.
Definitely. Definitely a great pickup on Rosalind's
Yeah,
side.
well, the sign-on bonus could have been better, but
Oh, that's awesome.
You mentioned you worked in the VA, you've done private practice, you worked in the military, and you've obviously been a teacher at Rosalind Franklin for some time now. Um, I've talked to a lot of CRNAs in the past who've had nothing but positive comments regarding this profession, and so I kind of ask you, like, have you been pretty satisfied with this career overall, with all the things that you've done, and can you attest a little bit to that?
yeah, I think one thing you'll notice about the profession is that you will rarely come across a CRNA that doesn't love what they do. Um, and that's pretty amazing, to me. I've met many physicians who regret becoming physicians. Many people regret what their career choices were, but I think the type of a job that we do is so hands-on and so satisfying, that it really promotes people really wanting to do what they do, and it's a rare thing to be very happy in what you do. Um, the fact that I can transition that into teaching others to do this is has been really, really satisfying for me as well. I love the teaching side of it. I love interacting with people that want to do this, and help them succeed. I think that's been a very big part of my satisfaction. So again, I think the career lends itself to job satisfaction. It really does.
Why do you think that is? Because you're mentioning physicians who you see regret their jobs, but like you don't necessarily see that with CRNAs. Like, what about this profession do you think makes it so
Well,
special?
it's funny, and it's usually not anesthesia providers, so it's not anesthesia physicians. Although I have seen dissatisfaction in their field as well. But surgeons in particular, I've met many surgeons who regret doing what they do. They've gone through such extensive, long training, even into their surgical specialties, and then realize once they're out, maybe this is not something I want to do for the rest of my life. But they're sort of stuck. It's kind of, they've invested all the time and money, and now they really have no outs, and they feel stuck. I can't say that for everybody, but I have anecdotally heard this from several people. I know that, but again, I have never spoken to a CRNA that didn't love what they did.
Same.
There's something about it that has this great satisfaction. You do multiple cases in a day. It's like multiple success stories in a day, right? There's something satisfying about taking care of somebody and waking them up again and getting them through with a good, positive surgical experience.
And not to mention that I think from our perspective too, and you probably see it on your end, is that there is a lot of ICU nurses and nurses in general that don't like the nursing profession. So I think that that's probably why you've seen so many ICU nurses begin applying to CRNA school, especially now that the COVID traveling money has kind of decreased a little bit. But I think that's really a testament to this CRNA profession again, is that people come away with a lot of satisfaction from it, and financially they do well, and really just their quality of life improves altogether.
And I think it attracts a certain type of personality as well. I mean, you have to be an ICU nurse or a critical care nurse of some sort to actually get into a program. And, we see it in the ICUs. The people that are ICU nurses, are often type A's and overachievers and are driven, in a different way. And I think that's the type of people we get coming into anesthesia. They're continuing to be driven, and at some point they feel ICU is probably not enough. They need a little bit more. And that certainly was the case for me, even though I kind of knew my direction. But after a couple of years in the ICU, it was like, okay, it's time to get out on my part.
Yep. No, and I think that's similar to a lot of people, because I think that COVID, unfortunately, pushed probably a lot of people out of the profession that not only did they leave for advanced practice roles or roles outside of the bedside, but they also pushed people out of the nursing profession altogether. So I think that we're seeing probably more people that have that 2 to 4 years of experience that are applying, and because really that's when a lot of the burnout sets in the ICU, especially if you are busy those first couple of years. So at this point, our listeners have heard a couple different why CRNA questions, and this is definitely intentional on our end, because the why do you want to become a CRNA is a pillar of many CRNA applications and CRNA interviews, and it's absolutely going to be a question that you get asked many times throughout the application process. So, for the remainder of this podcast, we're going to talk about ways to improve your CRNA application. And in case if you haven't already realized, Dr. Kallio has some experience, to say the least, in deciding who gets into RFU's CRNA program, and definitely has expert advice in that category. So, Dylan, why don't you take it away?
So for the why CRNA question, we were just kind of wondering what you think some people can do to strengthen that part of their application, and like what should they be avoiding when they're talking about the why CRNA.
That's funny because we've changed our essay question, and I should preface this by saying that I am the admissions guy at Rosalind Franklin. I'm the guy that actually reads every application, and that YCRNA is on that application. But we did change the wording a bit this time, because what we did find was we kind of got generic answers, and I think a lot of students will try to answer that question with what they think we want to hear, which is a wrong approach. I can't tell you how many applications I've read about YCRNA, and they say, well, because I like pharmacology and hemodynamics, I like, that's my drive, and it's like, okay, but there's got to be something deeper than pharmacology and hemodynamics. I can tell you that was never my drive. I didn't go into anesthesia thinking, "Ooh, I like hemodynamics. I'm going to be an anesthetist." That's not what drove me, and I know that that's more of an answer that is more programmed than it is probably validation and truth. So when we change this now, what we look at is I'm trying to find the applicant that is driven, and how do you do that? Um, how do I find that person that has the drive to complete a difficult program like CRNA school? Do they have the grit? How do I get that out of an essay? We changed up our question to ask about their life story. What are the successes? What are the failures you've had in life to get you to the point of where you are right now? That's what we want to hear, because that tells me your drive. That tells me what the grit, because as you guys know, you're students right now, that it's not an easy program, and it does take drive to do what you're going to do. So that to me is more important than anything else.
When the well runs dry for your love for hemodynamics and pharmacology, you better have really good reason on why you want to become a CRNA, because ultimately the work ethic and the requirements of a CRNA program really push you to need to have a reason beyond just a love for pharmacology, because everyone coming into the profession has that. So what is your reason why you want to become a CRNA?
Yeah. What are your particulars that got you to applying into the program?
And it doesn't need to be anything that's, exquisite or necessarily out of this world, but what makes it unique in terms of your, like you said, your life story, what led you stepwise to really to the point that you are at where you are now.
And truly, when we ask those questions about your struggles and your successes, and how you dealt with those that's the important piece, because you guys, my guess is you've struggled through certain parts of this program already, right? All of you have had
Yep.
struggles. How did you deal with it? How did you respond? Those are the
Yeah.
things that are important. That's the stuff I.
Yeah, that's awesome.
So definitely a degree of like being genuine too.
Yep, absolutely, and that's hard to pick up in an essay, right? That's hard to pick out in an essay, and the essay is only one piece of the application process, but it's an important piece. Yes, your GPA is important, and did you get your CCRN and all that? Those are all important pieces as well. But everybody's got their CCRN now that applies basically, and everybody's got decent grades that applies now, and so everybody's on the same footing. But how do we differentiate people when you have many more applicants than you have?
That's why they pay you to do what you do. That'd be so tough for me.
It is, and last year we turned away hundreds of qualified applicants, and we hope we made the right decisions.
Yeah, we're just kind of going to talk a little bit now about the ideal CRNA applicant. So, kind of going off that, a little bit about the basics. So, for anyone looking to apply, we'll need the minimum of these. So, we need a bachelor's degree or higher in nursing, an active RN license, and the prerequisites are going to vary from program to program. But I'd say pretty much every program nowadays is at least minimum going to require the CCRN and a minimum of 1 to 2 years of ICU experience. So, kind of going into that ICU experience, I kind of wanted to ask you, Dr. Kallio, is there like an ideal ICU specialty that you guys look at for a CRNA application? I mean, obviously we have a variety. Like we even have NICU nurses, we have people with ED experience, we have SICU, CVICU. But is there one that maybe might look a little bit better or will give you a little bit more preparation?
So that's a good question, and I don't have a great answer for that. I can say that we've had great candidates come out of really specialty ICU. You've got neuro ICUs and CV ICUs and pediatric and NICUs, where you're really really focused into one area. I say you probably have there's probably an advantage to you from your success in a program if you came out of a more of a generalized med surge where you get a lot of everything versus just heart patients or just NICU patients. We have absolutely taken students that have been in the NICUs and in the pediatric ICUs. I think it's harder for them in the program, just because it's such a different population, and in the program in anesthesia training we're pretty much focused on adults. Yes, you have to get your pediatric cases in, and all that, but the vast majority of the stuff you're doing is going to be working on adults. So I think coming from a pediatric ICU or a NICU, you might be at a slight disadvantage, but it's not going to deter us from taking you, from that perspective, because you do meet the general qualification even if you work in those units. But I think you're at an advantage if you had probably an adult ICU experience in a general ICU where you've seen everything: surgical cases, medicine cases, trauma. You were kind of a catch-all. But that's not the world we live in. So not everybody works in that kind of a unit.
And it also kind of depends a little bit on the person too, because like you mentioned with the generalized ICU, if you're kind of willing to like learn in a more deeper level about each patient you get versus a nurse who's just kind of taking your patients and going through the motions, you're going to get a lot more out of that, regardless of what unit you're on. At least I could see from our perspective as students too. You can definitely see the ones who paid a little bit more attention in the ICU instead of just going through the motions each day as well.
Oh, absolutely. I agree with that.
Yeah, and really the importance of like just overall the high acuity ICU. I think just taking care of patients that are on vasoactive medications, that are on mechanical ventilation, that have hemodynamic monitoring, and getting exposure to that, and not only exposure but also having an understanding is super important too. What did you say, Dr. Kallio?
Yeah, absolutely. And but more importantly than that, sometimes is I think it's the length of time that you've spent in an ICU. I mean, the requirement is 1 year of critical care experience. Well, you guys probably realize 1 year is not a lot in an ICU. You're probably just getting your feet wet, feeling comfortable in the ICU after 1 year. If you've got 3 or 4 or 2 or 3 or 4 years, I think all of a sudden your experience difference is quite different, and the maturity level is quite different at that point as well.
Yeah, I felt like it for me, like it took probably 6 months to a year for me to like really get my footing. And I started school with about 2 years. And even then, to be 100% candid, like I don't think one more year in the ICU would have hurt me in any way. But at the same time, I wasn't going to turn down the opportunity to, I was applying to CRNA school for a reason, but I knew at the end of the day that it wasn't the end of the world if I didn't get in. But when I got in, I said, okay, you have to be 100% committed to that. And I think that's also a good point too.
In our applicant pool, I think our average is about 3 to 4 years.
I think another thing that's useful is like a lot of people take their CCRN and apply, and they never even get to apply the information they learned from that course or from taking the test. I think like for me, taking the CCRN and being able to apply the information I had learned while I was studying for it was helpful during my ICU experience as well.
You get the best out of the CCR, and when you study for it for like a month or two leading up. The people that study for like it like a week or two prior, and sure, you might pass it, but like I think just really taking the time to go through those questions, go through the Barron's review book helped me substantially to really just round out like
And so much of what you
what I was
do in the
doing in the
ICU is
ICU.
transferable, to this role.
Oh,
Um,
absolutely.
but the biggest difference I think is that when you're an ICU nurse, you're protocol driven, you're orders driven. When you're a CRNA, you make the decisions, you're making the calls, and that transition is often
Yep.
difficult.
Definitely. I think that's why it's super important as an ICU nurse to definitely know the why of everything you're doing, because a lot of times you're even catching mistakes that other providers might be making.
Yep.
Obviously, we need a bachelor's degree or higher in nursing. Do you guys have any special preference as someone who has a master's degree versus a bachelor's, or not really?
No, it's a problem actually with the master's programs, is because there's so many master's programs out there now that are online, that you get transcripts back and it's 100% A's, and it's all online. And if I look over the years, I've been doing this for a while, there's certain programs I know these must be really kind of easy programs to get through, and it's kind of doesn't really tell me as much, versus maybe the master's entry program where I know there's a lot of material in a short period of time. Were they able to manage that sort of a program versus getting maybe a master's in leadership or something online somewhere? Probably, to me, the master's entry is going to hold a lot more credence than that online program of you know nurse leader type thing, or nursing administration, or that sort of thing. I think those are two very different type of programs, and I take some of that into account when I'm looking. So the things we look at is, I look at your basic nursing education first. Where how did you get it? Did you get a bachelor's in something else first, and then did the 1 year intense nursing program to get through, or the 2-year master's program to get through. You get through those programs. We know those programs are difficult and not easy because it's, again, it's a lot of information in a short period of time, which you guys might attest to in anesthesia training.
Yeah, for get used to it because it's it doesn't
Yeah.
change.
So, what specific character qualities do you look for in an applicant? I know you like you mentioned grit, but like, what are some other qualities you're usually looking for?
So, we you have to be able to interact with patients in a really short period of time in our profession, right? You've got to be able to establish trust in 5 minutes. You're going to meet that person for the first time in the morning, and you've got to establish trust in a really short period of time. If you're really extroverted, you may have trouble doing that, right? And that's not going to come across well. So I think being, having some, I'm sorry, if you were really introverted, that's going to be a problem. If you're an extrovert and you're social, I mean, that's going to come across as a positive in here. How do we find that out in an application process? Well, that's where we do the interview process. And at Rosalind right now, we're doing an assessment that's online where you're asked multiple questions, and you have to answer and respond to those in a very short period of time. We're trying to mimic, an in-person interview, which we had to get away from during COVID, and found that as our application processes ramped up, it was a lot more of an efficient way to do it, and so we've stayed with that online assessment piece. But that's what I'm looking for. I'm looking for someone that I think can interact quickly with the patient and build trust. That's more of a gut feel than anything else right now. There are some AI tools that are helping us with personality development of patients in these interview sessions with our prospective students. But that's totally a new thing that we really haven't nailed down yet. Does that help us? Does it not really help us? I can't tell. We can't tell that yet. We're not making decisions based on it yet right now. But that personality piece of being able to, you may have great grades, but you have a really hard time interacting with people. That might be a really real negative. Yeah, you'll pass boards, but how are you going to do in clinicals? How are you going to interact with people? Or if you're overly aggressive, how do we, that might not go well in clinicals either. You've got to, we're trying to find that person that's a team player, that has got some grit, that's got some personality, um, that can make that quick connection with a patient or with their preceptors, that they're people they're working with on a daily basis that might change every day. So can you adapt to that? How adaptable are you? Those are the traits we're kind of looking for. It's not just your grades. It's not just, like I said, I have turned away 4.0 students in this program because I felt that they were not going to be great candidates when it came to actually doing the hands-on work, the clinical work. Does that answer your question?
Yeah, that does. And then, so do you feel like you miss out on seeing some of these like personality traits without having the in-person interviews? And do you think RFU will ever go back to having some in-person interviews?
I truly doubt it. Our application numbers have gone up so significantly year over year, that the time of bringing in 15 or 20 students on a day interview day, I mean, we would have to have 15 to 20 days of that straight, which is very faculty intense, student intense. Whereas now with the online assessments, we ask the same questions. um, you have the benefit as the applicant to do this in your own time, and when you're ready, um, and there's some thinking time involved versus a quick interview where we ask you a question and we expect a response right away. On the assessments now, we ask the question, it gives you a minute or two to think about it before you have to, and the camera turns on and you have to answer it. So I think there's some advantages to this, and we still get the same answer, but probably in a more relaxed way. So we probably get a more honest view of that person versus the in-person interview, which I think sometimes was, how much of this is actually true and how much of this is, are they actually just saying just to think that that's what we want to hear. That's always the worry, right?
Yeah. So you talked about it a little bit earlier, Dr. Kallio, with the CCRN, and we spoke about that in our last episode. So would you say that like 100% of students that are applying, or essentially 100%, have their CCRN?
It's Yeah, it's in the high 90s. I know, I see, I still see occasional ones. It's usually those that have just gotten out into the ICU, that that haven't done it um, yet, and maybe are planning on doing it. But by the time the application rolls around, those are points in the overall process that you lose if you don't have it. Those are gimme points, if those are, that everybody has. Um, if you do have it. So I think you're at a disadvantage, absolutely at a disadvantage if you don't, because it's one way of putting two candidates up against each other that are very similar in every other way. But if one has their CCRN and the other doesn't, well, that might be that's our decision point potentially.
Yeah, and it's really also a good way for students to show that they do understand some of this content on paper. At least they can say, okay, this is
Yep.
like what you said. If you have two of the same candidates up against one another, you lean towards the one with the
Well,
CCRN.
and I also think that if I look at that student that didn't do it for some reason, I'm concerned a little bit about their drive,
Yeah.
right? Because are you driven enough to do the things that we know we're looking for?
Hmm.
And if you're not, again,
That's an
if I'm
excellent
weighing
point.
you against someone that of everything else being equal, that might be my decision.
So Rosalind, to my knowledge, also requires some letters of recommendation. How important are those to a student? Do you think that they do help, like kind of on our end? It seems like, okay, if you have physicians that respect you, whether it be intensivists, surgeons, you don't get that respect overnight. You get that respect by showing that you are not only a good nurse, but you also do understand in depth why you are doing the things that you're doing.
So we actually don't require an actual letter of recommendation anymore. We used to, but we don't. Now we just want a list of references that we could call if we had
Okay.
questions. And I think the reason we got away from it was, well, you're not going to ask somebody to give you a letter of reference that you don't think is going to give you a good letter of
True.
reference, right? You're only going to ask people that are going to say glowing things about you. So
Yep.
that's what we found. We found there was never a letter of reference that had anything negative in it, on these people. They were all glowing. So again, what were we really getting out of it? Versus if I have a listing now of people that I can call and I can ask them specific questions if I have a question about somebody. Um, that's a lot more useful to us than having three identical papers of letters of recommendation that say that you're the greatest thing since sliced bread.
That are the same template that they use for everyone.
Right.
Yeah. Okay. No, that's excellent.
We got away from that, and now we have a listing of three references that we can contact if we have questions.
And overall, just for those listening, I think either way, don't underestimate the power of forming meaningful connections with providers, with with everyone that you work with, because in the CRNA profession, in the nursing profession, word travels very quickly, and if you have a bad reputation, there's people that have connections to CRNA programs across the country. And so don't underestimate the really, I want to say first impression, but not even that. It's just being a good person and being
Absolutely. And
respectful to those that you work with, and being a dependent person that people can count on when they work with you.
yeah, and that actually plays out really well in our profession, that it's a very small world. And you get garner a bad reputation, it travels, and you may have a hard time finding a job down the line. So yeah, it's a small world, smaller than you think, and especially in our profession. But yeah, garnering people to be your mentors, to be your go-to people, and creating those relationships is key, even in general nursing, in regular nursing. Absolutely.
Transitioning here towards the science and overall GPA, kind of a trend we've noticed when looking at all these CRNA programs. I'm pretty sure it's very similar at Rosalind Franklin, is that you need a minimum GPA of a 3.0 or higher in undergraduate, preferably about a 3.5 GPA, especially with your science. You kind of touched on like definitely GPA is important to an application, but kind of based on what you said, there's definitely more factors that we look at. So even you mentioning the 4.0 GPA definitely won't automatically get you in. Something that I've also kind of heard from, there's certain schools that people went to for their undergrad when looking at their application, is like a 3.7 at like a university school look any different or better than like a 4.0 from someone who did a lot of their prereqs at a community college?
We know that there's different levels out there. The small community college versus the Big Ten school or something that has a reputation of being very difficult. Unfortunately, I can't. It's hard to pull that into the decision making. So we pretty much will go by what their GPAs are. Again, if I have two equal students and one I know went to a very difficult school and one went to an online program mostly, then I might weigh those slightly differently. If I'm wavering between two people. But again, the GPA is not the end all be all in the application process. And we look at three different GPAs and we weight them differently. So we look at overall GPA of all the education you've done. We look at your nursing only GPA, and then we look at your science GPA, and that encompasses everything that you've ever done. So if you were one of these people that had a career before nursing or had several different things going on prior to you deciding you want to be a nurse, probably have a much longer record with multiple transcripts, and maybe you weren't that great early on, science wise, and you didn't really figure out what you wanted to be until down the line. We I take that into consideration a little bit, right? I look at more what have you done in the last couple of years, so if you struggled with science early on, but later in your career, in your college education, those science grades are great. I have to look at that in that light. So the number itself, yes, it gives you an idea overall, but it's not the whole story. And we do look at these things on an individual basis that way. Um, and it's just one point in your application requirements that we look at is the GPA. We have taken students with fairly low GPAs in the past. I've taken students with science GPAs in under three, just because everything else that in their most recent stuff was much better. Their maturity level was good. We felt that these guys had the grit to dig themselves out of that situation, and so when you look at what our average GPAs are of our applicants, well, if it's 3.5, well, it means that, yeah, we have some 4.0s in here, but we've also got some low threes in here, and so it doesn't mean that you have to have a 3.5 to get in. And like I told you before, we've turned away 4.0 students just because from an interview perspective, they weren't that great.
I think that's an excellent bridge to just say that for those looking to apply to CRNA school, or even that are, amidst their nursing degree, I think that it's just an excellent point to make that it's not the end of the world if you do get a bad grade in a class. And if you are looking for a way to improve your application, a good way is to go and take a graduate level statistics course or a graduate level physiology, and just to try to help boost your science GPA. And what you had said, Dr. Kallio, is that more recent GPA is definitely more reflective of the student's time period at the time of application. And I think that also plays a role in showing the students resiliency too, because people go through stuff, things happen that are out of people's control. So don't think that it's the end of the world if you get a bad grade in a class. Just keep pushing and have the resiliency.
Yeah, exactly. And we know that there's situations, single moms, during college. Well, they had other responsibilities as well, and their grades may have suffered from their life events at the time, or going through illness while they're in school, or caring for somebody that may have been ill. Those things have an effect, but those are the things we need to know though
Yep.
when we're making decisions.
Goes into
So
your
that
life
needs to
story.
come out.
Goes into your life story and your process of becoming a CRNA.
It goes back to, tell me about your struggles, tell me about your
Yep.
successes.
That's really nice to hear from my perspective too, because that you guys, that's just one simple component. Because I don't know about your guys in nursing school, but mine like never rounded for like anything, which is fine. But like there were like 3 or 4 grades where I was like at a 94.9 or an 89.9, which is like the difference between a B plus or an A minus, and like that's a difference between my overall GPA being a 3.5 to 3.8. So it's kind of hard to quantify that, and I kind of explain that. But since that's just one component, there's really a lot more to a person than missing one extra question on a test could really make the difference there. So that's good to hear from my perspective.
Going into like shadowing experience, I know like nowadays it's kind of like hit or miss whether you really need it. It kind of became a little more optional as COVID went on, it seemed like, for most schools. But I think it's an important part of the application. It also shows you whether you really want to be a CRNA and whether you're gonna fit in the role that you're applying to do. So like on average, like how many hours would you recommend a student or a prospective student try to achieve prior to applying?
Well, the shadowing it's become it's a lot harder to do nowadays, especially post COVID. Hospitals are, you just can't walk into any hospital and say, hey, I want to shadow, right? So it's mostly you're going to be able to shadow at a place that you're actually employed in. We want you to shadow because we want you to understand what the role is. I don't want you coming in from the ICU and then never step foot in the OR to see what an anesthetist actually does. So it's more of a, do you know what you're getting yourself into experience. So if you don't do that, that's a big negative on our point. So that's why we want you in there shadowing. So, 2 or 3 shadows is probably sufficient just to see, that you know what you're getting yourself into. Um, and shadowing with a CRNA is important because I think you want to see what their role.
Another thing is, do you like? So I remember when I first did my shadow experience, I went there the first day. Didn't know anything about anesthesia really. Didn't know. I knew what propofol was. I knew what fentanyl was. So I knew those two drugs when they pushed them, and I knew what sucks was, but I didn't really know anything about like induction, maintenance, emergence. I didn't really understand any of the other concepts they were talking about. Do you recommend that someone looks a little more into like those kind of that's the series of events that someone goes through prior to going to a shadow?
Yeah, it's not as much what the experience is, but that it's more important for us that you see what the role is, right? I think we've had occasional students in the past that got into the clinical role, got through didactic fine, got into the clinical role, and then realized, man, this is not for me. There's a lot of responsibility here, and taking those sort of things out of your shadowing experience is more important. I think, can you picture yourself doing what this person's doing, right? Understanding that this patient's life is in your hands and your decisions impact that. And that's why we want you to it's not just so you get to see what drugs they use or whatever. It's more of, can you see yourself doing this down the line?
I definitely think that's something I've been able to like appreciate a lot more as I started the program. I feel like the more and more I get into it, the more and more I understand like how much my choices will impact someone when they're on the table under my care.
Yeah, you're the one making the decisions at the end of the day. And when I think Dr. Kallio, I remember you saying something in an open house that I went to that really resonated with me, and you said something along the lines of, when something goes bad or when crap hits the fan, we'll substitute a word in there. When crap hits the fan, everyone looks at the head of the bed and everyone looks at you. And so I think I've just always kind of kept that in the back of my mind during this education, is because we're not doing it. You're not going to school for the grades. You're not going to school for, um, just to basically fly by and to get a degree. You're going to school because at the end of the day, someone is going to be looking up at you as you drift them off to sleep. And that's a human being, and it's someone's mom, it's someone's sister, it's someone's daughter, whoever it might be. At the end of the day, I think that's really just so important for why you have to work hard during school. And it's not just about your grades, it's not just about the piece of paper, it's more than that.
Absolutely. Couldn't agree more.
In the last couple of years, we have seen the GRE kind of fade away, and it's kind of a black cloud for a lot of people. So, what can you tell us about that in terms of its utility or its lack of utility?
We found no correlation. It's a simple answer. We found zero correlation with success in a CRNA program to your score on a GRE. Um, and so if it's not really going to help me decide, for you, it's a waste of an exam.
A waste of money for the people applying.
Yeah. So, and I think it's a trend going around the country is that GRE has been going away. We're not the only program that doesn't require a GRE anymore. We got rid of this 3-4 years ago. And certainly I can tell you the level of our quality of students has gone up over the years. So it certainly didn't impact the success or failure of anybody. So then why require it?
So we've got a couple more things for the remainder of this podcast. Dylan is pretty big on emotional intelligence, as we all are, but I think Dylan has done some research and literature review of that. So, Dylan, why don't you take it away with regards to the importance of EI as well as grit?
How do you see like emotional intelligence like relating to the CRNA profession? Obviously, we kind of get to do the fun class and learn about it. But like, in what ways have you seen it like firsthand in the OR?
So when we certainly embrace the EI, emotional intelligence concept in our program, good, because we teach it. We make you take an emotional intelligence test in your early part of your student career. We initially actually we're trying to look at that as, is it a means of being able to find great students, and maybe we would base admission or denial on your EQI score. Well, we were sort of talked out of that for multiple good reasons, but what we found is that um, by not using it as an admission tool, but by using it as a tool within the program to improve your emotional intelligence, to make you more aware of these things, we can not create, but we can hopefully improve your emotional intelligence throughout the program, so that you guys can, it has shown, we've had a lot of success with it. Students have responded well to surveys post that they really enjoyed that and it's helped them. And so we know that emotional intelligence is a moving target and can be improved. So that's how we've embraced it now. And those that are willing to embrace the strategies to improve that, we find, become not just better CRNAs, but better people, right? And we're trying to make you, we're trying to make you as good as we can get you. At the end, we want to turn out a very good CRNA in all aspects.
No, that's a great answer. I think the some of the biggest takeaways that I've gotten in this podcast and is just really the importance of, and you highlighted it throughout, Dr. Kallio, is the importance of determination, the importance of grit, and really the importance of work ethic. And I think Ben, Dylan, and I can all attest, as we said earlier, that that gets you through this program, because on your worst day, when you fail a fluency, when you fail an exam, you get a bad grade on a paper, on your worst day, those are the things that keep pushing you through. So last question for you, Dr. Kallio, and we plan to ask all of our guests this. What is your favorite thing about the CRNA profession?
My favorite thing about the CRNA profession is my ability to interact with my patients and give them a great surgical experience where they come through and can afterwards say, "Wow, this wasn't that bad. This wasn't as bad as it was. They really took good care of me." And to me, that's success. If they felt that they were well taken care of, then that's a feather in my cap, right? That's the satisfaction that I get out of this. So that means you're constantly trying to make it the best for them. Are they gonna wake up nauseous? No, I'm gonna take care of that. Are they gonna wake up in pain? No, I'm gonna take care of that. And that requires work during the case. I could ignore some things and then they wake up in pain, but that's not very satisfying for me or the patient. And I think that, to me, is the greatest satisfaction.
That's great, Dr. Kallio. I think even on our end, we can see that you have that same philosophy as a program or associate program director, because I think that you are very forefront in saying this program is hard, but if you put in the work ethic, if you put in the time, we are going to produce a very high quality product at the end by the time of graduation. And we're going to get you through the rigors of this program and make sure you come out the other side with the ability to practice independently to your full scope of practice as a CRNA. And from me personally, I'm extremely grateful for that. There's not a day that goes by that I am not thankful to be in this program and to be thankful where we're at. So on behalf of Ben, Dylan, and I, thank you, Dr. Kallio. Thank you for being on this podcast, but just thank you for being a great person and a great member of the CRNA specialty, because I think you just make the CRNA specialty better being in it, and we're just extremely grateful for you to have an impact in our lives and in our academic progression as well. So thank you so much, Dr. Kallio. Thanks for coming on, and we will talk soon.
Awesome. Thank you, guys.
Ben and Dylan, thank you guys so much for helping to put this podcast together. Dr. Kallio, thank you for joining us as our first guest for this podcast. Thank you to all of our listeners for tuning in. Please feel free to check us out on Facebook or Instagram at the Mechanics of Anesthesia. And as always, we'll talk soon.